Hello and welcome, I'm Delia Delore. This program gives you information on a major achievement in St. Lucia's healthcare. It's called One Patient, One Record. The system ensures health records can be accessed safely and securely at medical practices across the island. I'll tell you more about that later, along with the services available for substance abuse and drug and alcohol rehabilitation. I'll test you with questions along the way, and contact information will be on the screen. This program also features interviews in Creole with Fennell Neptune. So let's start accessing our health services together. Coming up, how your ID is the gateway to your urgent medical needs. How doctors who have not treated you before can have instant access to your prescription requirements. How family and friends can be supportive with substance and alcohol addiction. But first, when it comes to healthcare, there are many issues that are assumed and misunderstood. So even though the intention is good, unless you know the facts, you could miss out on the truth. Here are some of the perceptions you may have about confidentiality, which is one of the major factors you can rely on with One Patient, One Record. Limited patient privacy. The Health Management Information System makes data much more secure and private. Issues of confidentiality. Patient privacy, confidentiality and security of patient records on its computers are safer than paper records. Security leaks. Also, One Patient, One Record has restricted access so that only doctors are privy to all your private and medical information. Hello, Andrew.
Hello.
Thank you for joining me. I want to talk about St. Lucia's One Patient, One Record, which allows the public to go into any hospital or polyclinic, give their information, and then the doctors or the health professionals will have access to their health files. What are your thoughts on that system, especially, being a solution at home and abroad?
Well, first and foremost, I must say it is quite comforting and pleasing to know that St. Lucia has made that bold step to try to raise their standards to really international levels where patients actually have that one-stop shop where all the data and all the information can be accessible by all stakeholders in the health sector. I think that is a very positive and a very good thing for St. Lucia, because I think it makes data management a lot easier. It means that when a patient is not in a position to provide the necessary information, him or herself, that the professional can go to this one-stop location and get that history pulled up, unhindered, unaffected by other circumstances. All the information is right there, and it could be used to make informed decisions on the way forward. I think that's a very good thing.
What would you say to people who are undecided? Because there's good and bad to everything, and there'll be some people saying, oh, I don't trust the system, or no, I don't want to be involved.
Well, I think with very good security systems in place, with very good data management systems in place and protocols, including laws, in terms of who has access, what levels of access you will give to various persons in the hierarchy in terms of the health sector, people should feel confident that their information is safe, the information will not be abused, and the information will be used for their betterment. So it is all about gaining the confidence and the trust of the public and letting them see that the service you are providing in terms of the data management is secure and safe.
Now, you're part of that type of service in the UK. How does that work for you?
Well, in the UK, the health sector is managed by the National Health Service. And of course, they have their own database. And like I said, they use something called the GDPR to protect all citizens in terms of their data management. So there are hefty penalties if there is any data breach. But within the health sector, different people in the sector have different levels of access to that information.
It's the same that happens in St. Lucia.
Yes. So, for example, you would not want that database being compromised. For example, if an insurance company gets access to your personal data, that can affect your premiums. You don't want that happening. So you want only the authorized persons to have access to that information and to use it not to your detriment, but to your betterment and to your improvement based on your medical needs. So going back to your question, in the UK, the NHS has its database, but what they do is they allow individual surgeries to offer information services. So for example, at my local surgery, they have opted to use an application online. So at home, if I want to see a doctor, I don't have to call my surgery to say I need to see a doctor. I could just pull out my telephone, go to the application on my phone, and book an appointment. I would get a series of slots. I pick the one that suits me. I book an appointment. I can give a little update in terms of what the appointment is for, what my needs are, what my concerns are, what my fears are. If I want a repeat prescription, I can make it right there, and I don't have to go to the doctor. I can go straight to the place where the medicines are being given out.
Yes.
And I collect my repeat prescription if there is need for it.
Well, unfortunately, we haven't got that service available in St. Lucia, but we have started with one patient, one record, because at least the health professionals have access to all of that, and they can, for example, if someone went to Soufrière and fell ill there, but they live in Castries, they could visit the Soufrière hospital, and the practitioners there would know what medication that they were on and so on and so forth. So I feel that's a huge benefit, as you said earlier. It's the start.
Yes.
And it's very welcoming, I think.
Yes, and added to that, what I like the most about this system that we are introducing here in St. Lucia is that it actually keeps a record and a history of everything pertaining to your medical life and your medical history. So when a new person takes over your case, there is continuity. There is information that is confidential, that can be trusted, that is based on evidence that certain things have happened leading up to where we are at the moment. So it makes management of your medical situation a bit more secure when you compare that with the days when everything was written on a piece of paper in some doctor's physical filing cabinet. And someone would have to go to that cabinet to get that information to pass it on to a third party.
Yes.
So it's good to know that we are moving in that direction where there's a centralized database and everything is right there for ease of access. I think that will improve efficiency in the system.
Thank you, Andrew.
My pleasure.
If you lived in Corinth and went to Canaries but fell ill and visited the Soufrière hospital, staff at the hospital would be able to know the important things about you, like where you live, your medical history, blood type and history of healthcare, only if you are registered for one patient, one record, which is stored on the Health Management Information System that keeps health records confidential and secure in one place. To tell us more, here's Information System Manager Sheraline Monrose.
The role of the Health Management Information Systems Unit is the development, implementation, and maintenance of the primary care health management information systems across all of the public wellness centers, district hospitals, as well as the polyclinics. We also provide some oversight for the hospital health management information system, as well as the integration between the two HMIS systems to facilitate a one patient, one record on the island. Okay, so as indicated, we have two HMIS systems, one for primary care and one which is going in now for the hospital. As you will know, patients will traverse between the wellness centers and the hospitals. At some point in your life, you may go to the wellness center, you may need to be referred to the hospital, etc. What the one patient, one record does is that it facilitates that your information, where required, is transferred and easily accessible across the wellness centers and the hospitals. It also ensures the identity of the patient. So you would want to know that it's the same patient who's coming here. Before you treat the patient, you want to ensure the identity of the patient. So once you've ensured the identity of the patient, what the one patient, one record aims to do is to facilitate in a very secure and safe manner the transfer of the patient medical records where required to provide that quality of care to the patient. Once you come in, at any point, be it the primary care HMIS, via the wellness center or the hospitals, you're registered in the HMIS system and you're assigned a unique patient ID. Because the systems are separate, what we do, we have what we call a master patient index, which sits between the two HMIS systems, and it verifies the patient. So for this, we will require that patients walk with a form of ID, so we could actually know that you are who you are. Once we could verify the patient's identity, their demographics, etc., they get assigned a unique number in the system. And it doesn't matter which wellness center they go to or which public hospital, wherever you go, you would be that one patient. So we'd always ensure that we're treating the correct patient. And again, as information is being entered into the HMIS, as you're being treated, all your demographics, your medical notes, your allergies, everything related to that outcome, that episode of care, will be entered into the system. And of course, as I said, let's say, God forbid, a patient will go to the hospital and they arrive unconscious and they're not able to indicate, for example, what their allergies are or what medication they're on. Something that is critical to ensure that the patient is treated properly. Once you're able to verify that the patient is who he or she is via some sort of ID, then the doctors, the nurses are now able to query the system to get that information to be able to treat the patient in a safe and secure manner. Some persons live in the south, for example, but they work in the north. So perhaps you see a doctor down in the south, or you've been to a wellness center in the south, but something happens to you today and you're in Castries and you're wondering, you know, what's going to happen to me? Because of the one patient, one record, the information is distributed across the island via the HMIS system. So it doesn't matter where you first saw the doctor within the public healthcare sector. As long as you saw that anywhere within the public healthcare sector, your information is always there. So you always have the, you know, some persons don't remember, for example, the name of the medication. They would say, oh, I'm taking this white tablet, you know, this pink tablet, they don't know. But the HMIS system would query and would provide you with information on the exact medication. It does not matter the point of entry. And that allows you to treat the patient. So you don't have to walk with your medical records, like walk with it manually. It can be accessed over the HMIS system. Again, I cannot stress in terms of accuracy and safety in terms of treating the patient, because it provides the person who's treating the patient, the clinician, with some kind of medical history on that patient to better inform whatever the outcome or the treatment is. Currently, it doesn't, but our system is of international standards, where we've incorporated all of what we call health level 7 standards, which allows it to integrate with any other system. So currently, for example, we are integrating with the lab information system, and this allows us to, of course, once a patient comes to the wellness center or the hospital, once a lab request is made, it's transferred directly to the lab information system at the hospitals. So for example, you would go to the Grizzly Polyclinic, you're given lab tests. In real time, that information is now available at the lab at any of the public hospitals. And what this facilitates is, of course, like I said, that once a patient goes there, the patient doesn't even have to walk over to bring the request. It goes there directly. The lab is actually processed and the results are entered and it's returned to the HMIS system. This lab information system is a system which is being used by many labs, private labs on the island. So because we've done it in the public healthcare sector, we now have the facility to integrate with the private healthcare providers who are interested. So the facility is there, but currently we are working on strengthening primary care, public healthcare. I must indicate that both the primary care HMIS and the secondary care HMIS is really extremely secure. It's much more secure than what happens now. The systems are what we call role-based. So for persons who visit the wellness centers or the hospital, you would know that they perhaps different level of staff. So you have the persons who would do your demographics, collect your name, you have the persons who do vitals, who might be a nurse. You have the doctors, you have the pharmacists, etc. Traditionally, when you would go to the wellness center or even a private doctor's office, you have one person, sometimes it's a secretary, a receptionist, who pulls out your file. So this person, and in your file there is all of that information. With the health management information system, you only see in the system what you need to know for your job. So persons are assigned roles based on what they do. So for example, the first person that you normally meet at the wellness center is what we call a community health aide. That person would do your demographics, they would take your blood pressure and your other vitals. This is the only thing that they would see in the system. They will not be able to see, as you go higher in terms of rank, you see more. So a community health aide is limited to your demographic, what they do, only what they need for their job, nothing more. The nurse might go on to take your complaints, but to do so, the nurse would see what was entered before. She would see your demographics, your vitals, your complaints. The doctor needs to see all of that information in order to treat you. He needs to know what your history is, he needs to know what's your blood pressure, what's your sugar, he needs to know what you're complaining about. And the doctor so the doctor really now has the highest level in the system where they're able to see all of the information and what the doctor enters, nobody else, so no nurses or community health aides can see that information. You must have the role of a doctor to be able to see that information. Okay, so this makes the system so people would know that you've come and they know that you went to see a certain doctor, but they don't, or a certain clinic, but they do not, in the system, only the persons with like I said, the highest permission, which is a doctor, would know exactly what you came for. So your diagnosis is secure. And this is across all the clinics, across all the wellness centers, etc. Unlike, like I said, I've gone to private doctors where each time you go, there's a different receptionist. And that person could just open the file and in there's everything. So with the HMIS, it makes it more secure. It's secure, the information is secure, it's confident, and even if the information is available throughout the different wellness centers on the island, again, role-based, only a doctor can see has that highest level of information.
Question: which document must you present to complete registration for the Health Management Information Systems One Patient, One Record? Answer: your national ID or passport. Your ID provides you with a unique number in the system, so wherever you go, your demographics, medical notes, and everything related to your care will be in the system. Unlike private healthcare, where the secretary and anyone else with access to your files will see your information, the HMIS One Patient, One Record system only allows information depending on the level of the person requesting access. Let's follow Ayana Edwin as she visits the Castries Wellness Centre to register for One Patient, One Record. She was initially seen by health aide Randy Zephyrin and then the district medical officer, Dr. Robin Murrell. Step 1. Bring your ID to your healthcare provider. Step 2. Your information is placed in the Health Management Information Systems One Patient, One Record. Step 3. Your information can be accessed by doctors in St. Lucia. If you are prescribed medication, your prescription will be in the system, so the pharmacist has a record of it and all of your previous prescriptions. Go home feeling safe and secure about your healthcare. Question: using One Patient, One Record, patients can access their prescriptions from wellness centres and hospitals that have pharmacies. True or false? Answer: it's true. Showing your ID at a pharmacy at St. Lucia's hospitals or wellness centres will enable the pharmacist to locate your prescription.
A ministère sorti l'année unit Health Management Information System qui est responsable pour assurer yo développer, implémenter et assurer l'année un système pour management information santé à ces polycliniques là, place santé avec l'hôpital au niveau pays. Unit là aussi responsabilité pour assurer des marches neuf là one patient one record, ça veut dire yon patient qui a yon record médical au système santé. One patient, one record, ka assurer ki le yon patient ba information et yon mette yon système là, yon si sa joindre même information ça là a pièce place sorti et ben l'hôpital ou li pays. Dema ça là ka aussi assurer moun joindre ka sorti yon mérité. Système ça là c'est yon qui s'en sauve et ka assurer identifier un patient. J'ai ouais pour système information unit là, Mademoiselle Sheraline Monrose qui explique manière système one patient one record la ka travail. Premièrement, les gens qui visité une place santé de l'hôpital, yo aussi kaini pour marcher puis quatre identifier yo. Et puis un nurse qui registre yo système là et puis numéro ID ko patient. Deuxièmement, toute information à son patient qui a système là. Mais il important pour savoir qui un docteur tout seul qui sa ouais record médical patient. Nurse là qui savent cette information est supposé savoir bagay ko pressure, mesure moun ka peser et plusieurs les autres bagay. Puisque information ça le système là, pièce l'autre docteur qui ne système ça là et ka traiter même patient, kay ouais information médicale ça là et ça kay assurer yo bay patient là ka yo mérité. À dans situation côté docteur bay patient remède, information ça là kay aussi un système là et ka pharmaciste a place santé kay sa joindre record médical ça là et pièce les autres remède patient là ja servi te passer. Système One Patient One Record, c'est yon qui est un standard international. Pour plus d'informations à ce système, yon sa visiter place santé yo à commune là. S System One Patient One Record, c'est yon qui s'en est sauve. A, oui, B, non. Réponse là c'est oui.
How does St. Lucia's healthcare system manage substance abuse and implement prevention, plan programs, campaigns, educational activities, and then monitor and evaluate their efforts? The coordinator of the Substance Abuse Unit, Charmaine Hippolyte, tells us how.
The role of Substance Abuse Unit in St. Lucia's healthcare is basically to provide information as far as drug use and prevention is concerned. And we do that through dissemination of information at schools, community levels, and even private and even the public workplaces as well. We do that in collaboration with a number of stakeholders like the Ministry of Health, the police, Turning Point Rehabilitation Center who offer treatment, also the Bodily Correctional Facility. All of these we offer courses or support for the staff so that they too can empower their employees. So in other words, we're offering capacity building for them so that the programs that we develop, we actually share it with them so that they could pass on this information to empower their staff. As far as our achievements go for now, we actually had the first drug report and that was sponsored, and it was submitted. Also, we completed our MEM, the multilateral evaluation mechanism. This is a tool which actually measures drug use and the issues in St. Lucia. That was completed. Also, although this was a Bureau of Standards initiative, we actually have, well, when I say we were riding on this wing of Bureau of Standards, the labeling of cigarette boxes, so that persons could actually see the warnings and so on. They are colorful, they are at specific dimensions. Also, the amendment as far as smoking is concerned, that was actually passed. It's actually published in the Gazette. I think it was July 3rd. So all of those things we have achieved thus far. Also, we have been looking at the Global Youth Tobacco Survey. This actually gives us an idea as to how adolescents respond to tobacco in terms of use and even knowledge. Additionally, we want to look at our early warning system, that is the formation of what we call a drug information network. From that, other stakeholders can actually give us information, and that information could serve as a tool or a measure for us to actually detect prevalence and early warning signs of drug use in the community.
Question. The Substance Abuse Unit collects statistics and data that helps inform policy. True or false? Answer. It's true. The Substance Abuse Unit needs statistics and data which helps them create educational programs on the prevention of substance abuse.
A secteur sorti l'année en unit substance abuse qui responsabilité pour ménagement des affaires à biser drugs, ça veut dire substance abuse. Whole unit ça c'est pour implémenter programme, activité et campaign pour empêcher moun à biser et baisser les drugs. Coordinateur pour unit substance abuse, Mamzelle Charmaine Hippolyte, parle des services là yo ka pochiwe et puis activement yo.
Unit mwen ka pochiwe service côté qui nous ka instruit moun, mamay l'école avec les autres moun en commune about effect drug, les moun servi drug avec ça qui ka rive yo. Ça veut dire ça ka rive santé yo, ça ka rive famille yo. Et puis qualité bagay comme ça avec nous ka faire ces services là qu'on nous ka aller instruire moun côté ay dans l'école yo et ben ko yo ka travail nous ka ba yo information qui écrit avec les autres bagay comme ça. Unit moi c'est un petit unit mais nous ka faire un chay travail qu'on nous paye. Pour achievement nous a fait ça nous créer un drug report côté qui un moun fait un report ban nous et report ça la ka parler about tout ça qui a fait cette lycée about drug. Nous ka aussi dit nous about qui les drug qui pli comment qui les qui ka servi moins et plus avec qui groupe moun maman l'école femme non mais bagay comme ça. Aussi malgré ça là c'est un projet sorti Bureau of Standards. Bureau of Standards ni côté yo mette portrait à sous boîte cigarette et c'est portrait ça là yo ni information kay di moun about danger drugs et puis nous ça yo fait ka moins de travail nous côté qui nous vle moun savent about ces bagay ça là. Aussi nous vle faire l'autre activité ça nous ka kouye anti-drug strategy. Nous j'ai plané pour faire ça en haut, l'autre mois en haut, avec aussi pour nous rétablir ça nous te créé un observatory côté qui tout le monde qui savent that unit nous c'est unit là côté toute information about drug service drug prévalent avec bagay comme ça qui sorti en dedans unit nous avec côté qui nous ka informer l'autre groupe gouvernement avec tout l'autre monde about drugs en simplicité.
Est ou sa di nou whole unit substance abuse? A. Mette programme ek aktivite en place pour empêcher moun abuser drugs. B. Bay moun ki ka abuser drugs traitement. Réponse la c'est yo ka mette programme ek aktivite en place pour empêcher moun abuser drugs.
What is your perception of drug users and alcoholics? Do you know how to support people with addictions? According to my next guest, addiction has been viewed as a plague, but he says the disease can be compared to being diabetic, as addiction is biological but can be managed and treated. Here's Robert Huggins of the Turning Point Drug and Alcohol Detoxification and Rehabilitation Center.
We have somewhat of a negative perception coming from the public, to be honest. Some people actually think that when you come to Turning Point for treatment, what we do is we drain your blood in its entirety and replace it. Just want to mention for a fact that that is not what happens. The other thing is that we tend to have this attitude as a society that alcoholism or drug abuse is a moral issue, and that persons who are addicts, they choose to be, they can choose not to be, or to stop using the drug at any time. So persons who seek help are seen as sort of weak. That's the general idea. And we want to move away from that. We want to get to the idea that actually it's a biological thing. It's a medical model that we're looking at. It's hereditary, and there's a lot going on psychologically and physically. So we need to change that perspective and let people know that Turning Point is a place you can come to for help and rehabilitation. And that's the idea that we're trying to promote. Well, Turning Point offers detoxification and rehabilitation services. As part of our detox, basically you come here and you're allowed to let your body basically process the remnants of whatever chemical that you were on. In acute cases, you do go to the hospital. We don't manage those severe cases. But once you've passed that, the level at which it becomes a physical risk, more or less, you can come here, rest, relax, recuperate, take in some vitamins. When you got to the point that you are now feeling healthy and stronger, then you can start to participate in the rehabilitation aspect of the program, which is based on the Alcoholics Anonymous 12-step program. So you take part in lessons going through the 12 steps. We usually work the first 3 steps. You can go a little higher depending. And we have meetings daily as well for persons, and with other aspects including, health lectures and all these things that help to bring you up and raise you as an individual. We've treated quite a number of people. Over the past 3 years, we have treated, I think, I'm trying to remember the exact figure, but it was near 400 or 500. And we're aiming to increase, obviously, because we want to get the word out more to persons about what we offer, etc. We've brought in some new staff, increased our nurses, changed some procedures, etc. here, so we're more able to provide the type of support that we would like to provide for them. Going forward, I'm trying to shift the mood, the paradigm here to more of something like a spa-like setting. So we want to, change the colors, add a gazebo, add a flower garden, make here feel more like a retreat in which you can get your treatment, etc., and come out feeling more rested and like a changed individual. It's more of a holistic view. So it includes the spiritual aspect of the 12 steps, because it includes the physical aspect because we have our nurses and physicians on board. It includes the psychological aspect because we have our counselors here. So you can incorporate all parts of your life and come out being, a stronger individual as a whole. People coming in here, as far as the program is concerned, they receive fantastic care. The issue is when they leave here and they go back out, what kind of support they receive when they're out in public again with their family and friends, etc. People, places, and things, that's often mentioned here as something to be aware of. You want to avoid the people, the places, and the things that got you into the trouble in the first place. So you need to have support out there, right? So people need to understand that, like I said, it is not a moral issue. It's not a matter of somebody choosing to be an alcoholic or a drug addict. It is biological. It is there are many factors, psychological, etc., that contribute towards it. So when people are out there and they're trying to recover and trying to live their life better themselves, you should be out there supporting them instead of bringing them down. So if my friend has gone for treatment and I meet him someplace or I take him out, I shouldn't, I offer him a beer, he says no. I shouldn't be like, chide him or give him remarks or no. I should support that decision. Give him water. Even myself, I might drink water with him because me drinking a beer might be a trigger for him, right? In terms of family, not having liquor within the house, encouraging the good habits, being supportive in those ways. Within the workplace, not causing separation or treating that person differently because of their illness, what they went through, but not denying them opportunities for advancement, etc., because of what may have happened in the past, but understanding that they've gone through a change, they're bettering themselves, and they can do all that. So essentially, it's about us understanding, being supportive of their change, and doing what we can to help them maintain it.
Question. Drug and alcohol addicts can stop on their own if they really want to. True or false? Answer, false. Addiction is caused by many factors, including biological. Question. Turning Point Drug and Alcohol Rehabilitation Center offers meetings and services to addicts and their family. True or false? Answer: true. The center offers support, services and advice to addicts and their families.
Ada effort pour aider moun qui ka servi à chay drugs et bewam, Ministère de Santé aussi ni Turning Point Drug and Alcohol and Rehabilitation Center pour yo joindre traitement. A center sala yo aussi ka mette programme en place pour se moun sala pour changer la vie yo et venir primer moun. Yo aussi ka poursuivre service ko éducation sur drugs, entraînement sur manière pour vivre bon la vie, manière pour ménager la vie yo pour pêcher servir drugs et wam, service conseil et plaisir les autres. À ce l'année qui j'ai passé, Center a traité au 400 moun. Directeur pour Center Turning Point, M. Robert Huggins, parlait du changement y a voulu ouais by Center. Il aussi qu'il voulait ouais une place qui plus relax qu'au spa. Il aussi crié pour plus support aux familles et gens pour ces moun sala qui ka visiter Center pour faire changement la vie yo. Et de qui ces familles et gens yo brisé qu'au point qui ces moun sala qui ka servi drugs et wam aussi ka expérience changement di wotan yo en Center. Est ou sa di nou ki service yo ka offert a Center Turning Point Drug et Alcohol et Rehabilitation? A. Service conseil. B. Éducation sur drugs. C. Manière pour ménager la vie yo pour pêcher service drugs et wam. D. Entraînement sur manière pour vivre un bon la vie. Réponse la si, yo tous ces services yo ka poursuivre a Center Turning Point.
Visit your nearest hospital or wellness center and register for One Patient, One Record. It's yet another achievement of the Ministry of Health and Wellness that should be utilized. We hope this program has given you huge insights into the services and achievements of the Ministry of Health and Wellness. The Ministry strives to maintain international health standards through research, training and development, and of course working with external agencies and other countries. Don't forget, health is life. Goodbye.